Hello and welcome to the Social Protection Podcast. I'm your host, Jo Sharp. In September this year, we brought you the first of 2 episodes on social protection myths and misperceptions, all in the domain of how social protection affects individuals and households. In this episode, part 2, we wade into the trickier territory of how social protection affects economies and populations. As we do so, we're looking at perhaps not quite myths, but certainly common contentions. Do cash transfers cause inflation? Is social protection a cost or an investment? And is social protection only for the poor? In this episode, we're looking at different perspectives on those questions. The answers aren't always definitive, but the discussion is rich. So stay with me. To start us off, I have with me Dennis Egger, Associate Professor of Economics at the University of Oxford. Welcome, Dennis.
Hi, everybody. I'm super happy to be here.
Dennis, coming to you first with the first myth or contention for today. There is a common concern that you'll hear that giving regular cash payments to people will drive up or distort local prices, thereby eroding the value of the benefit, making things more expensive for the general population. What does the evidence actually tell us about whether social protection programs lead to inflation?
So I guess first I want to give a little bit of a framework, right? So typically when people receive cash, they'll spend a lot of that relatively quickly. That depends, of course, where they're at, in what country and what the economic circumstances, but often they get cash because they need it for immediate spending, their basic needs, things like that. Now, whether that creates sort of local inflation depends a lot on how they spend it and what they spend it on, right? So in our contexts in rural Kenya, for example, people spend it predominantly locally at local markets, local shops. So what that will mean is it creates an increase in demand for local goods and services for local enterprises and firms and shops. Now, the next question then is whether it creates inflation, whether these shops need to raise prices to meet that increasing demand. And what we find in our work in Kenya is that actually not very much. So we had a very large increase in cash. Basically, the cash that was given to the poorest members of society was 15% of annual GDP. So local demand went up by a lot and prices went up by 0.2%. So nowhere near the kind of size that you would need to erode away the positive impacts of cash. And so the benefits were real, basically, in real economic terms. Now, why was that? So our conjecture is that local firms were able to expand supply relatively easily just by importing more intermediates from other parts of Kenya, because a lot of the goods and services that were produced were sort of imported. But also because there was a lot of slack or underutilized labor and capacity in the local economy, these firms were basically able to service the additional demand relatively easily. So a typical barber shop has one worker, one barber who works there, sits there 8 hours a day, had maybe 5 customers. Now they have 7 or 8 customers, but they don't really need to hire anyone else. They don't need to sort of invest much more into additional capacity. They can basically just expand supply relatively easily and relatively quickly without having to raise prices. So what we find in our setting where there's a lot of slack, supply is very elastic, prices go up by very little. And I think that's probably true in many rural developing country settings, similar to the sort of Kenyan setting. Whether that would translate to other countries, more developed economies, urban settings, that is a bigger question, right? It'll depend on the same kind of questions. How elastic is supply? How easily can local firms absorb that additional demand? How close to capacity are they? It's hard to generalize, but certainly we don't find very much inflation in our setting.
And I believe that is consistent with another quite well-known study in this field that looked across 8 countries in sub-Saharan Africa, similarly found no systematic increase in local prices due to the introduction of cash transfers. But some studies can show small localized price effects, particularly in remote markets. And going back to your points about supply and slack, what might cause those and how might those be avoided if you're trying to design an effective cash transfer in those settings?
Yeah, I think there's 2 papers I'm aware of. One from the Philippines with markedly more remote settings than our Kenyan setting, which is very sort of densely populated, even though it is rural. And then another paper in Mexico with remote mountain villages, often hours walk away from the next village, sometimes only having 1 or 2 shops. And the theory or the model behind potential inflationary impacts there is that some goods, in the Philippine case, it was eggs and fish, might be in sort of limited supply. There's only like this many eggs and this many fish in that village at this particular time when the cash comes in. And so the only way for the economy to adjust is to raise prices. In the Mexican case, it's an argument about market power. If there's only one shop in the village, everybody has to go to that shop, and it's basically a monopolist, and they can do with the prices what they want, so they'll raise them. We looked at that in our setting, which is an entire county, much like a very big study in Kenya, and the quantitative evidence just isn't consistent with what these studies find there. And so while these mechanisms may be at play in certain very remote places, they certainly weren't at play in a typical rural county in Kenya. How to avoid these? I guess in the end, it all interacts with access to markets. So if you give people cash, they need things to spend it on, and firms and local businesses to supply them. And to the extent that they have access to markets through good roads and potentially an ability to expand supply more quickly, that will dampen the inflationary pressure. And in a study we're doing at the moment, for example, we're trying to inform local businesses ex ante before a lot of the cash is being transferred to local households. We're trying to give grants and credit to local businesses about a month before the cash arrives to see if they can then expand capacity, invest, stock up on inventory, things like that, to mitigate some of this potential price pressure. But I just want to say that to me, the way I read the evidence is that broadly, you don't see inflation on a big scale, even with very large inflows of cash. You might see it in some select types of goods, in select, very remote kind of places where these mechanisms might be at play. But I don't think it's something that you see across the board or that we should worry about too much for most settings.
And I guess we could speculate that that is an argument also for regularity or perhaps predictability as well, if not only recipients, but kind of markets and vendors roughly know when these transfers are likely to come in, they can be a bit more prepared. I'm just also interested in, more broadly, what other kinds of economic impacts of cash transfers do we see on local economies?
Yeah. Before I answer that, I would love to have one additional caveat on the inflation part. So what all of these studies show is inflation in the cross-section or on local prices. So prices in places that got a lot of cash versus in places that got little cash, right? What none of these studies is able to speak to really is, say, a government debt-financed expansion of the national government budget, right? Then we're really talking about macroeconomic impacts. Exchange rates might change. You might see sort of a broader debasement of the currency. So we're not getting into that. This is really about local markets within a country relative to other markets in the same country that received less cash. So that's an important caveat. Now, in terms of other impacts, we've already started tracing out the flow of what happens. So there's now hundreds of studies basically showing that recipients of cash transfers benefit tremendously. They spend it on whatever they think they need the most. And that's the beauty about unconditional cash transfers, right? Some might need to send their kids to school. In our recent work, for example, we show that child mortality declines drastically because people are able to access better healthcare, to deliver in a clinic in the Kenyan setting. And we find an incredible 45% reduction in infant mortality after pregnant mothers are getting the cash. So that's been extremely well documented. Basically, these concerns around people might spend the cash in silly ways or on gambling or temptation goods, we sometimes call them. That's sort of been debunked across many, many settings. What we then sort of go on to show is that this has not just effects at the individual level, but also at the market level. So the money that people receive is, in our case, spent locally on local businesses. The output of local businesses increases. They raise their wages. So both profits and wages for local business owners and workers are going up. Their income goes up. They'll spend it again in the local economy and local goods. And the money starts circulating. And what we find in our Kenyan setting is that for every dollar that was injected in an economy, $2.50 over the next 2 years of economic activity were created. So there's this multiplier impact of the cash circling around the economy and lifting up all boats, including through wages and local profits, again, at limited inflation. So basically what we're arguing is that the sort of direct effects that have been documented are probably an underestimate of the overall positive effects, because non-recipients benefit through this increase in local stimulus. The kids benefit, first of all, by surviving more. And now we're following up to see if their educational outcomes, cognitive development, and so on is improving as well. So there might be this intergenerational long-term impacts. Basically, there's just a whole host of things about households as well as the local economy that sort of benefits positively from an injection of cash in our setting.
The next contention we're exploring is the idea of social protection as a cost to a nation's bottom line, rather than perhaps an investment. Welfare payments are handouts, social protection expenditures are a drain on national resources. And that might be linked to the idea that social protection systems are a bit of a luxury or something that only wealthy countries can afford. And certainly during times of austerity, it's inevitable that there'll be a target for cuts. One way into this question is to talk about economic multipliers or return on investment. And with me to discuss a recent paper on this topic is Laura Carvalho, Associate Professor of Economics at the University of Sao Paulo. Welcome, Laura.
Thank you. Thank you so much.
So we've invited you on to talk about a recent study that you've been part of. What were the economic multipliers of social protection, especially in low and middle income countries?
So we put together a data set for social protection expenditures from 1985 to 2020 with 42 countries, both developing and developed countries. And we ran estimations of how additional units of spending in social protection affected GDP in these countries using modern econometric techniques. We found as overall results that for the whole sample, multipliers are positive and significant in a vast majority of cases. The average cumulative multiplier that we found is 1.84, which means for each additional dollar spent on social protection, GDP increases by 1.8 in average. That's a cumulative number because the effect, it doesn't happen just instantaneously, it accumulates over time.
So, what's happening in countries and economies and communities that takes us from an increased investment in social protection or something like cash transfers to that increased GDP that you're talking about? What's at work there?
One of the main channels is, of course, through consumption. In general, social protection doesn't affect the entire population in the same way. It's usually targeted to some degree to the low and middle income households. Of course, that is not always the case, and you have more or less targeted systems. For instance, the unemployment insurance is not going to be affecting the same part of the population as a targeted cash transfer. But in both cases, we're talking about people that have a higher propensity to consume relative to the average household. And so this is one of the reasons why social protection expenditures and social protection have such a high multiplier. These are people who, if they get an extra dollar, will spend that extra dollar. And this means that the aggregate consumption level will increase significantly as a result of the expansion in social protection. This, in turn, creates macroeconomic effects that increase demand for goods in general, and therefore has a potential to also stimulate private investment. So there are many studies also at the local level that show how a cash transfer system has, for instance, in a small municipality, huge potential to create a sort of a virtuous circle of economic dynamism, right? With businesses and services and stores opening in places that didn't have those before because of the money that starts circulating over there. So there is a distributive effect of social protection that was already well known. We know that social protection expenditures reduce inequalities, reduce poverty. But what we're looking at is how this in turn becomes a positive outcome for the economy as a whole.
Your sample had a lot of countries in it, and there was a fair amount of variation. I think you found that a multiplier around 5 in Mexico, so $1 of input translating to 5 in output, and as low as 0.7 in Paraguay. What explains the differences?
So it's very hard through this econometric technique to tell you for sure what explains the differences. Of course, there are different systems, and this by itself makes comparisons very hard, right? But we did try to create, or at least run some correlations between the multipliers that we found and certain country characteristics. And we did find, for example, that using different inequality indicators, Gini index, the share of income going to the top 1% to the bottom 40%. Like we tried different indicators, and consistently we found that for more unequal economies, the multiplier tends to be higher, even higher than for the more equal economies. So that's one thing that explains the heterogeneity. Another thing that we found is that there doesn't seem to be a strong correlation or a significant correlation between our multipliers and the level of income per capita in these countries. So that's another element that we found interesting. And we've seen arguments that maybe these types of systems worked well for rich countries, but they could be harmful if adopted prematurely in low or middle income countries. And that doesn't seem to be the case. Another thing we tried to look at is how the multipliers correlate with the actual initial coverage of countries' social protection systems by looking at the share of social protection spending in GDP. The results suggest that there is a negative correlation in this case, where actually countries with the lowest level of coverage have higher multipliers, which kind of reinforces the inequality results. So in places where coverage is not significant, that you start with a very small social protection system that is still underdeveloped, that are unequal economies, you actually tend to find a higher multiplier than elsewhere.
That does go back to the contention, is social protection best considered a cost or an investment? And perhaps to put it another way, can countries afford not to invest in social protection?
There was this idea that José Antonio Campo and Nathalie Gomes Arteaga have put forward in this working paper in 2017, which is this idea of an affordability myth. The myth that if social protection systems are prematurely introduced, then they may end up turning out a retarding factor in economic development. There doesn't seem to be evidence of that. So the positive and persistent multipliers that we found, they show that social protection expenditures can, in fact, contribute to development rather than slowing it down. Of course, it's not sufficient for economic development to invest in social protection, but still, I think it is powerful to add a piece of evidence to a large body of literature that shows that no, it's not a cost. It is a part of public spending that generates short-term and medium-term economic gains, as much as public investment, which is widely recognized. For example, there's this vast literature that looks at how high the multipliers are for infrastructure investment. And in fact, social protection has very similar multipliers as infrastructure investments.
Yeah, can you say a bit more about how they do compare?
We could not in this study look at that because of lack of data availability for many of the countries in our sample. But for specific countries, there are studies, like for instance, for Brazil, we had both multipliers as larger than 1 and very similar depending on how you ran the estimations. One would be a little bit larger and the other a little bit smaller, but really very similar. And the literature in general has found multipliers of around 1.5, 2, depending on the literature for infrastructure investment. What we found here in average is 1.8. So it's not strikingly different result. Of course, the infrastructure investment has other types of economic effects that go beyond the short and medium term economic gains. They have productivity effects and other pieces that are relevant that can have more results in the long term that this type of study doesn't capture. But in terms of the short and medium run effects, it's definitely similar.
That brings us to our final contention, that social protection should only be aimed at the poorest members of society. And to get us thinking, let me introduce Davide Rasala, who is ICREA Research Professor and Head of the Health Impact Assessment and Evaluation Group. Welcome, Davide.
Hello, thank you very much for inviting me.
Davida, in our first episode on myths, we talked about a recent survey with senior social protection policymakers about attitudes and perceptions towards social protection. And amongst other things covered in that survey, policymakers expressed a strong preference for focusing transfers on the poorest segments of the population. Many felt that the poorest 30% was about right. The next most common response was 10%. So this is perhaps not so much a myth as a fairly common policy setting. Nevertheless, there are, of course, strong reasons and many advocates for considering broader or more universal approaches. I was interested in the insights from a recent paper that you co-authored with others, which presents a strong case for broad-based social protection schemes, particularly to influence health outcomes. Your study estimates that social protection coverage expansion globally prevented over 3 million deaths in 46 low and middle income countries over 2 decades. And one of the key findings was that as coverage expanded, the impacts on child mortality and malnutrition grew stronger. So, simply put, why does broader coverage make such a difference?
So we'll bring here the perspective of social epidemiology. Really, we have to understand social protection and the idea of universal social protection, not just an economic and social policy, but an health net policy. We have worked a lot in Brazil, and we have really worked with Ministry of Health and Ministry of Social Development together, showing how really these investments, they save lives. Brazil has one of the largest conditional cash transfers in the world and one of the first ones, together with Mexico. And we recently published a paper showing that in the last 20 years, it has been able to prevent more than 8 million hospitalizations and more than 700,000 deaths. So when you prevent hospitalization, you really have the return that is not just in the long term. When you reduce hospitalization, you will have actually a benefit with a lag period of a few months or a few years, let's say. So really investing on that can give you a return of investment, as Dennis was saying, from an economical point of view, but now we can have also through the intermediation of a reduction of hospitalization, but in general, many other parameters you can measure. And the interesting thing is, as we always say, yes, reducing poverty, reducing socioeconomic vulnerabilities will have some impact on health. Everybody expects that. But I think even as a researcher, we were not expecting this number. We have published recently a paper showing that in indigenous populations, cash transfer in Brazil were able to reduce almost 70% incidence and 70% mortality in tuberculosis, for example. We see more than 50% in HIV/AIDS. And now I reconnect this to the question, narrower or broader? From the point of view of health, of course, when we narrow down and we focus on extremely vulnerable, the benefits are higher. So really, health, you can say, if you are constrained in terms of resources, focus on the poorest. Try to catch the extremely poor and concentrate there the benefits. But if you have a possibility to increase the coverage, of course, try to cover also not only the extremely poor, but also the poor more in general. At a certain moment, you will have a plateau. In the sense, at a certain moment, you will not have meaningful benefits in health anymore from a social or economic point of view. So it will be also interesting to compare the economic point of view and the health point of view.
Yeah, I mean, I guess what stood out to me was those headline findings. You know, there was strong evidence that expanding social protection broadly could have large health benefits, especially for children. The paper also concluded that coverage matters. Even modest incremental increases in the proportion of people receiving social protection benefits were associated with measurable reductions in mortality and malnutrition.
When we analyze a global study that we have done, and we are proud of it, we think it's important to give this global message. Still, when we try to interpret these results, we say, yes, universal social protection is something that has been worthy and has saved millions and millions of lives. There's no doubt on that. Now, when we want to try to interpret how to implement social protection using this global data, I will be cautious and I will say, wait a moment. Let's see country by country, situation by situations, and there we can really reason what is the best choice in terms of calibration and fine-tuning of the policy, I think, in terms of targeting. Also, amount of money, if we're speaking about cash transfer or contextual support in terms of healthcare and structure, etc.
I'd love to jump in because
of course,
so many of the themes you mentioned echo what we find in our data as well. And I can just sort of basically reinforce some of what you said. So in our setting too, the child mortality effects are concentrated among the very poorest. We know that the income health relationship is concave, right? So the most vulnerable, the very poorest, benefit the most. What's interesting is that the economic effects on income consumption are higher among the relatively richer because they might have fewer other constraints, access to markets. They might already have a business to invest into. They might have the skills to use the cash to earn a better wage on the labor market. They might be able to migrate, whereas the most vulnerable don't. They need it for food, and they need it for healthcare, and they need it for these basic things. And so looking just at the economic impacts misses out the real benefits that the most vulnerable have. And maybe looking just at the health impacts might then conflate some of these other impacts. So it's really important to look at all aspects.
You've talked a bit about Brazil, Davide. Are there other country examples you can draw on?
Yes, with the considerations I did before. So we have another project where we analyze the effects of cash transfer. We have already published a first paper on child mortality in Latin America. And we have seen also these effects outside of Brazil, of course. Brazil is always considered one of the pioneers, but actually the first randomized controlled trials on the impact of cash transfer on health were done in Mexico. So if I have to focus on cash transfer, we are actually worldwide distributed. They, as we were saying, they have overall and sizable and significant effects on health outcomes. This has been shown in several studies, but it depends a lot on the context. We are doing now another global study using more than 40 million persons worldwide. So the same study we have published, but now with individual level analysis. And we see the effectiveness. It's not just us. There are other groups. Actually, there is a study published in Nature 1 year ago, more or less, showing the impact of a global level of cash transfer in general. Now we are doing with social protection, more in general. I think all these studies, and including the study we are doing, are very useful at the global level to say, okay, the international organization should really promote this at the global level. After that, the implementation country by country should be carefully calibrated, fine-tuned, considering all the characteristics of the countries. But of course, overall, implementation, expansions in general of social protection has significant beneficial effects on health.
Laura, to come back to you, I'd just really be interested on your views on that question about whether social protection should only or mainly be targeted towards the poorest, and what kinds of evidence you'd bring to support that view.
Sure. I think what we were talking about here, and so the economic effects and the multiplier effects, of course, for the reasons I've described, namely the sort of propensity to consume a channel, the fact that if you give an extra dollar to people who are really at the bottom of the distribution, that's probably going to be spent. And that means the multiplier will be as higher as more you target to the poor. That's probably true. So if I stick to just a multiplier frame, then I would probably be supportive of the targeting. However, as we were also talking about the GDP or even the poverty consequences of each additional dollar in social protection are not just the only purposes or objectives we have in mind when we design a social protection system, right? And so I think it's important to highlight, being an author of a study that, of course, does tend to see the macroeconomic effects as connected to targeting because of the way the macroeconomic channel works here. I also think it's very important to design a social protection system with other objectives in mind. And these can go from the effect that a system has on the volatility of income, for example, on sort of how people face shocks to their income, and the volatility of income has enduring consequences both at the microeconomic level and at the macroeconomic level. And a well-designed system is one that also stabilizes income in light of a highly volatile economic environment in ways that create resilience in these economies. There are questions, of course, of vulnerability. There are questions of bargaining power, right? The fact that the more universal your social protection system is, then the more bargaining power workers have to exit, for instance, extremely precarious jobs and situations of work that are degrading. And so the fact that you give a floor to people's income is also something that can really affect the way labor markets function, that can create certain standards and favor certain standards that I would say benefit the economy overall and the income distribution to a larger extent, even the targeting, right? Because you're also affecting how much of the national income is going to labor and how much of it is going to capital. And so the functional distribution of income is affected by a more universal system. And of course, the issues of dignity and the right to a certain level of dignity come at play. And so definitely, there are some dimensions of social protection that enhance the more you target. But there are other dimensions that I think require more universal approach. And a well-designed system is also a system that looks at the characteristics of the countries. And there is no sort of one-size-fits-all solution. I also think that countries have different priorities. They're usually under very tight fiscal constraints, and they need to design their system based on what is the size of their informal market relative to their formal labor market, how their economic system is able to create alternatives. And so, yeah, it's just an answer that I think is way more complex than what we could address in this article.
Yeah, it's a great summary of the different kinds of objectives we might have for a social protection system, including the benefits of redistribution, being able to help people at times of vulnerability and shocks that put people at risk of poverty, even if they aren't already poor. And here we've basically described the whole purpose of a comprehensive social protection system. And of course, that doesn't have to be entirely government financed. Ideally, it has contributory elements by people and businesses that can afford it, and so on. In the earlier episode on myths, I did also touch on the myth, perhaps, of perfect targeting. I think it's easy to agree that concentrating resources on the poorest people makes conceptual sense, but a lot of the challenge is in the execution. It's well nigh impossible to actually target a sort of narrow band very accurately. Poverty is dynamic and so on. If listeners are interested, I would recommend to you some of our other episodes, especially the trade-offs of targeting, and also our episode on social registries for more. I wanted to briefly go back to the earlier contention or myth about affordability, cost versus investment. And certainly this idea that in times of austerity, it's something that can be sacrificed. Dennis, in your research, I understand you are actually looking at a large cash transfer experiment in Kenya. And this is a bit different, really very different from regular social protection programs in that it's a very large transfer, $1,000. Which is approximately 75% of the total of household expenditure for the poor households who received it. It's one-off, and of course, because it's experimental, very well studied. But looking at this question, what were the impacts of that one really very significant investment?
Yeah, so this was a cash transfer program that was implemented by the NGO Give Directly. It's unconditional, so people can do whatever they want with the money. It's a lump sum, so it's basically delivered all at once. So first, what happened? People spent it. That led to an increase in local economic activity, increases in other people's income, a multiplier of 2.5 in real terms. We've now added to this. We've shown that there's significant reductions in child mortality. If you only cared about child mortality, this might not be the most cost-effective policy. But if you then say, compare this to a targeted program that gave pregnant mothers or pregnant women cash right around the time of childbirth, then it starts to be similarly cost effective as many other health kinds of interventions that the WHO recommends in this setting, for example. And so all we're trying to say with this is cash should play a role in health policy. It's not the only role, but it should potentially play a role. What will obviously really matter is what the long-term impacts are, right? And this is not published yet, but 5 to 7 years later, we still see 10% higher consumption expenditure, better food security, higher assets for recipients and non-recipients. And if we did this sort of multiplier exercise and added another 5 years, we would get to much higher levels than 2.5 over the first 2 years. Joe, if it's okay, one other point that you mentioned, you sort of compared our one-time lump sum to other smaller, more regular transfers, like what most government programs look like. And that's true. We are not comparing this in our study, but there's an adjacent study that some of my co-authors are doing on the UBI versus lump sum. So they have three study arms also in Kenya. One where people get the lump sum, one where people get basically a monthly transfer that after 2 years is the same amount as the one-time lump sum. And I think the findings there are pretty clear, is that everybody prefers the lump sum, and the lump sum has bigger positive impacts, at least for these first 2 years. Politically, I don't know how easy it would be for a government to implement this, because you then have to stagger. Some people are going to get it now, some people next year. So that's trickier. And I also want to say that for some populations, they'll always sort of need this recurring transfers. Think about orphans, think about the elderly, think about the disabled who have no other means to use the lump sum to invest it productively to generate their own income generating activities. So probably it's a mix, but certainly what our work shows is that this is a lump sum nature, thinking of cash not just as a helping you bridge some temporary issue, but as a thing to change your life and invest in sort of escaping poverty in the longer term, play a big role. What they're also doing in that study is that there's another arm where they give the monthly transfers for 12 years to really get to this UBI idea. Maybe you're changing, your risk behavior, the kind of approach to life. And the results there are obviously not yet out because we're only 2 years in. So we'll have to see what we find there.
We have featured a couple of episodes in this podcast over the years on the idea of the universal basic income. It's a very tantalizing political idea that currently only exists as an experiment in places like Kenya through Give Directly. The work that you've done really is part of the corpus that is often cited for proponents of the UBI. I guess my question is, how should we apply these lessons to regular government social protection, which you've covered?
Yeah, I mean, maybe our work, although it does get cited, is not the best, right? Because it's not universal. It was targeted at the poorest 1/3 of each village. Although Give Directly has now shifted to universal, because basically what they realized is that in many settings, like for example, now I work with them in Malawi, almost all people live below the international poverty line of $2.15 a day. And targeting is actually really difficult to do and to do cost effectively. And so sometimes the costs maybe outweigh the benefits of targeting, as well as potentially the conflicts around who's eligible and who's not that can change the social dynamics in the village. So that's why they've started to favor more this universal model.
Yeah, it is interesting in light of that earlier conversation about directing resources to the poorest that this experiment has gone in a more universal direction. And those points about the costs of targeting are also well taken. Davida, how do you view this question, social protection as a cost versus investment?
Yes, we have studied this, especially during the extremely strong economic recession we had in Brazil in 2015 and the implementation of austerity measures. And we have seen already an increase in infant and maternal mortality in Brazil after 20 years due to the economic crisis, but also due to the implementation of fiscal austerity measures. So we have shown how many lives can really be lost because of implementation of fiscal austerity. We see in Brazil, for example, we have huge wealth inequalities. Worldwide, we know every day we see how many billionaires we have are increasing, how many, this huge amount of wealth, individuals and corporations. And we are starting to evaluate how taking just a fraction of that, 1%, 2% can solve many of the problems. In Brazil, now there is a fiscal reform in debate discussing about taxing the ultra wealth. And as you probably know, is politically very complex discussion, even if it's somehow elementary, because you just take a small amount of money from ultra wealthy individuals, you allocate in extremely poor individuals, and you will get incredibly benefits. So it really shouldn't be a discussion, but
how much of global annual income for 1 year do you think you would need to give 1 year, a full year of income, like these cash transfers that we study, to every one of the 600 million people living under $2 a day? What percentage?
Is this an answer you have?
I do.
Yeah, okay.
0.3%.
0.3% to provide.
So if all of us, everybody in the world, gave 0.3% of their income of this year, we could give 1 year of income to everybody living below the international poverty line. That's 600 million people could benefit from that cash transfer program that we were describing just now. So just to underline it with numbers, Davida's point, that These are massive benefits for very, very small amounts of money in a global perspective, right? Yes, they sound expensive. Yes, they sound big, but it's all a perspective.
Our colleagues at the ILO and other international organisations who often come on this podcast talking about international solidarity in the face of global need, climate crisis would agree with you there. Dennis Edgar, Lara Carvalho and Davida Rasala, thank you so much for joining me on the Social Protection Podcast today.
Thank you very much. Appreciate the invitation.
Thank you so much. Thanks for having me.
Thank you very much. It has been a pleasure.
Before we go, we like to end each episode with some quick wins. We ask our guests to bring in recommendations for research, news, or events that have sparked their interest and that we think you should know more about. And following up from our episode earlier this year on the World Summit for Social Development, I am delighted to welcome today Kostas Papadakis, who is Principal Social Affairs Officer at the Department of Economic and Social Affairs. Welcome, Kostas.
Thank you. Thank you for the opportunity.
So we're coming back to you now after the World Summit on Social Development concluded last week. I understand that you facilitated the intergovernmental process for negotiating the political declaration that came out of that summit. Can you give us some insight into that process, the behind the scenes, if you will? Were there aspects of the declaration that particularly inspired debate, needed a lot of negotiation to land? What was it like working on that process?
First of all, it's important to know that the process of adoption, the political declaration, was led entirely by UN member states. It was negotiated and concluded 2 months before the actual summit. The whole process started with the so-called Food for Thought paper in early 2025, and that was the basis of negotiations. That started in February and concluded in September. Just an insight, it was a very intensive process. Over 60 hours of negotiations among member states that came very well prepared. I would say that all aspects of the political declaration necessitated a lot of negotiations, a lot of back and forth, inside the room and outside the room between the delegations. And that was due to the technical complexity and the political sensitivity of the topics. And of course, due to the different approaches adopted by the two main groups in the room. On the one hand, you had the Global South countries, let's say, represented by the G77 in China. And on the other hand, you had the Global North, the European Union, Canada, New Zealand, Japan, South Korea, etc. Now, the differences were less about which issues to include than about the depth and the focus of their treatment, and therefore the terminology to use. For instance, some delegations, notably from the Global South, insisted a lot on the importance of strong references to the role of family as a central enabler of social development. On the contrary, the Global North countries insisted on recognizing not only one, but various forms of family. Another area where we witnessed a lot of debates was that of sexual and reproductive health and rights, where countries, notably from the G77 group, wished to see a reference, of course, to the notion, but not to the rights, while countries from the Global North wanted to see references to sexual and reproductive health rights in the declaration. Another area of intensive negotiations was in relation to the right to development, with some delegation contesting its treatment as a collective human right. And I will mention one final one on the question of the inclusion of a reference to the need for renewing the global social contract, something that in the end did not materialize. You will not find this reference in the text. This notion, as you may know, is embedded in the mandate of the International Labour Organization and refers to the need to repair what we call the implicit agreement that exists or should exist between governments and societies, workers and employers also, to cooperate in shaping together peaceful and resilient societies through social justice. Now, in the end, the political declaration did not refer to a renewed global social contract. because countries from G77 argued that that was an ill-defined concept at the international level. So in the end, what you will see in the text is a variation of this concept, which it refers to the renewed global commitment, let's say, and actions to develop in close consultation with workers and employers organizations so as to ensure more cohesive societies. Yeah, that is a selection of the issues that really necessitated a lot of debates until the last minute.
It's really interesting to get that insight into some of those subtleties and maybe big differences as well in the way that countries come to the negotiating table and the kind of issues and language that matter to them. So in the end, looking at the political declaration and the summit overall, what did you see as the most important outcomes in a year where we've had a lot of key summits like this, as you mentioned, the Financing for Development, and of course, as we speak, we're about to head into COP30 as well.
Yes. Let's start from the big picture. At a time where multilateralism is under pressure due to conflict, a trend of isolationism, threats of trade wars, etc., just holding the summit on social development and adopting a political declaration by consensus, and with very few dissociations or explanations of vote in the end, it is a success in itself. I think it sends a strong signal that international cooperation and solidarity are not just ideals, but real solutions in today's context. And that is an important message we should not underestimate. Another important outcome was that the summit, interestingly enough, focused on solutions rather than just problems. There were over 200 side events, solution sessions, 100 online events, 6 high-level fora, all highlighting or emphasizing examples of social policies that do not often make headlines. So I believe in a world full of negativity, that was a refreshing dose of optimism and evidence that progress is possible. Another important outcome is how the summit and the political declaration treated the question of social protection. The declaration places social protection systems at the heart of the social development agenda, recognizing these systems as a core enabler for poverty eradication, decent work, and social inclusion. In fact, contrary to Copenhagen, the declaration of the first World Social Summit 30 years ago, which referred to social protection 2 or 3 times, this time the political declaration was all over the document, with over 25 times referenced in the text. So overall, the political declaration does not treat social protection as a side issue, but rather as a key ingredient for achieving sustainable and inclusive development. And this matters a lot. First, it signals a shift from earlier approaches with social protection simply as welfare or as a safety net. Also, the political declaration sees social protection as a foundation of a just and inclusive society, which reinforces the idea that social protection is a right and should be a structural component of any development policy or strategy, including in developing countries, and not just as a tool to be used only in case of emergency. And also, the political declaration emphasizes the need for universal coverage and for social protection floors. Now, in particular, there is a provision to increase the coverage of populations by at least 2 percentage points on an annual basis, which is considerable progress. And more importantly, I would say, the declaration stresses also the need for sustainable financing of social protection systems, both through international cooperation, but also through country-led strategies. So overall, I think social protection has been treated as a cross-cutting tool across all pillars of social development, which is key for making our systems more resilient in the faces of multiple crises we're experiencing.
I might just ask you one more thing to connect those outcomes to the process of negotiation that we were discussing earlier. How did social protection feature in that negotiation? Was there kind of broad-based consensus around the role of social protection amongst member states, or is it still a really key area of advocacy that some countries are progressing over others? How does it feature in that context?
No, in the context of negotiations, starting from the food for thought paper, going through the 0 drafts and ending up with the final text of the political declaration, I can tell you with certainty that was one of the rare areas where there was no disagreement on the importance of social protection. One area which was considered by practically all member states as a key, not only for emergency strategies or to cope with hardship, but also as a continuous strategy of social development, a strategy that also can facilitate the green, digital, and demographic transitions. Perhaps where there was a little bit more debate was on how to finance the social protection, which is also the elephant in the room. So to summarize and answer your question, no disagreement on it's important. And again, I consider this as a major achievement, both of the summit and of the political declaration itself.
Kostas, thank you so much for making the time to join us on the Social Protection Podcast today.
Thank you very much.
And thank you for listening to the Social Protection Podcast, brought to you by socialprotection.org. You can find all of our episodes on the socialprotection.org website and on your favourite podcast platforms. Be sure to like, subscribe, and leave a review. Back next month. See you then.